Hello, finally I have the time to be myself. So today I'm gonna share about Urticaria, which is hives that normally people call. With this one, we normally divide to children and adult. The causes are different. Normally children, it's caused by post-viral rash, which is the hives happen after a virus infection or some sort of tumor, but it's less likely. The other one is for adult. So adult normally will look at three causes. The most common one, which is the thyroid disorders, allergies, and tumors, or any growth in the body that can cause chronic hives. By definition, chronic hives is 6 weeks and above, but to me, any hives that more than a week is a concern. So I would treat the one that already more than 1 week with internal adjustment, and we will start to find the cause of it, because it's very abnormal for a person to have hives more than a week, and if it happens every day. So let's say children, I can share with you about a case of the one from Brunei. So that time it's about 5 o'clock. I'm about to close to leave the shop, and then I received a call from Brunei. They asked me to wait for them. They are rushing from Brunei Darussalam, which is their capital, and that normally take 3 hours drive to my place, but they miraculously reach here within 2 hours. So I cannot imagine how fast they drove, but I saw a kid which is about 3 to 4 years old, very severe, and the kid was carried by the father to the outlet. And when I saw the kid, it's one of the most severe hives that I've seen. So apparently this kid has been discharged from hospital based on the request of the parent. It means the parents signed the paper. So they drove here to ask for help. So in hospital, they gave the kids some prednisolone injection and IV, but it wouldn't help. So the next day, the face and the body was swollen. The moment that I saw the kid was so swollen that both legs were have bruise. So the kids couldn't walk, and we couldn't see the eyes properly. It was just a line, and the whole body was swollen. So I immediately gave the treatment, and then we gave internal adjustment, and then 3 days later we follow up. So they have to drive one more time to Miri, which is where I am, and the rash has gone by 80%. And then by the 7 days, the 4th days actually has gone by almost 100%, but the 7th day we have to follow up again. It's completely healed without a scar. When I saw the kids, the body is full of scratches, and by the 7 days, if you using a normal method, I don't think you can even not to see a sign of scar. But this is what we have to do for the kids, and the kids was very happy. The other case for the kids was another 4 years old from Bintulu. So that is chronic hives. So chronic hives that happened for about a year already, and then it was introduced by someone that came to see me. So these kids, when I saw the kids, both legs were swollen and full of hives. And we start to manage the kids internally, because this girl has been brought to many clinics and doctors, and using basically antihistamines and some steroids, but wouldn't help. So within a week, she has no hives happened on her until now, because we review her for a few times. There is no hives anymore. So very pleased that things can help these kids. For adult cases, more normally what we see is thyroid related issues that cause the hives, and that may happen in many cases, and some of them are allergy. There were a few that we found there's a growth in the body. So for example, I found a patients that I referred for blood test for chronic hives, and then that shows that the tumor marker is a bit high. Then we send to the gynae to check, and really there is a growth in the uterus. So she has gone through the surgery and things like that. There is possibilities that the person has got autoimmune disease also. So that is one of the disease that can brought up hives. So of course, in some cases we can't even identify the cause of it. It can be combination of cause, and can be a cause that we cannot find. But hives is a symptoms, it's not disease. Surely there's an underlying cause that cause these symptoms to appear. So if you have a chronic hives that's more than a few weeks, I think this should bring you an alarm bell that you should to get yourself checked out. So this would probably prevent you from very unfortunate event, which is preventable and curable. Right, that's my sharing today. If you like it, please follow me and give me a like. Cheers, bye.